At last week's American Society of Clinical Oncology meeting in Chicago, which is by far the largest cancer meeting in the world, probably the most exciting talk was a talk about a drug called TDM1, which is a drug that will be used for breast cancer that overexpresses a gene called the HER2/neu gene. The HER2/neu gene is a growth regulatory gene that all of our normal cells have two copies of. In about 20% of breast cancer patients, those cancer cells may have hundreds or even thousands of copies of that gene, and this is referred to as an overexpression of the HER2/neu gene. In the past, this was a particularly aggressive form of breast cancer and had a high risk of metastasis. Probably the most important advance in breast cancer in the last 5 or 10 years has been the development of a drug called Herceptin. Herceptin is a monoclonal antibody directed against the HER2 positive breast cancer cell and has resulted in a vast improvement in the prognosis of HER2 positive breast cancer. One of the more exciting developments have been the development of other anti-HER2 drugs, and at this point in time, that is probably the most exciting part of breast cancer research. A drug called Tykerb was developed many years ago, which is a very good drug in patients who have progressed after utilizing Herceptin. The newest drug is a drug called TDM1, which is an antibody drug conjugate, meaning that a drug has been attached to an antibody, and in this case, the antibody is Herceptin, the same drug we've been using all along. And the company that developed TDM1 found a way to attach a drug called emtansine, which is an older, actually fairly toxic drug that was discarded back in the 70s. And they have found a way to attach this drug or molecules of this drug to the antibody Herceptin. The way this works is that the Herceptin, as it does as a single agent, finds the HER2 positive breast cancer cell, attaches to it, and takes the emtansine chemotherapy molecule intracellularly and thereby kills the HER2 positive breast cancer cell. The trial presented at ASCO last week, the Amelia trial, was a trial of metastatic breast cancer patients that were HER2 positive that had actually progressed on a Taxol or a taxane plus the drug Herceptin. There were about 1,000 patients that were randomized to either receive the more standard approach, which would be Tykerb, the second-line anti-HER2 drug, plus a drug called Xeloda, which is a pill, and they compared that to the single agent TDM1, which is Herceptin plus this chemotherapy molecule. What they found was in this pre-treated group with metastatic breast cancer that had already had Herceptin, that the TDM1 worked much better than the Tykerb plus Xeloda, which was heretofore the best treatment for Herceptin refractory patients. In this pre-treated group, the progression-free survival was extended by at least 3 months, and it would appear with further follow-up that the overall survival will be improved compared to the Tykerb plus Xeloda. The other exciting part is that TDM1 has very little toxicity. No hair loss, no nausea and vomiting, and the most common toxicity they saw was a clinically insignificant decrease in the platelet count. So that the hope is that this TDM1 will be moved probably in the front line of metastatic disease and then ultimately replace Herceptin in the adjuvant setting. This is a very exciting development. This is a drug that has very little toxicity, and if it's better than Herceptin, would be a huge advance in the treatment of HER2 positive breast cancer.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.